4 million people are living in Kenya. Only 4 million of them in Nairobi. Of all doctors in Kenya, 80% is working in or around Nairobi to serve these 4 million. For the other 40 million, what kind of doctors can give adequate health care to them? Family medicine is a specialism that gives a master training for medical officers.
There's been a dramatic change in Iten Hospital in regard to the services they offer. Visit then and visit Iten right now, you'll get very nice services, unlike before. Not just the services being offered by the same nurses, doctors, but even that watchman at the gate.
So do you know that it's been run by family doctors, and do you know what a family doctor is?
Honestly speaking, madam, I don't know what a family doctor is.
Professor Otsula sees the importance of family medicine. He's one of the founders of the first training in Moi University Eldoret.
Family medicine is a specialty, but in a generalist form. It's a 4-year training which equips the doctors with a wide range of skills to be able to deal with many conditions that affect health of the people.
Professor Otsula is a cardiothoracic surgeon. He experienced what a family physician means in the health system.
I lived and worked in England, and I didn't go to the hospital before I was seen by my family physician. And I thought that worked well. There was one person who knew the families, who knew everybody's illness, and who are able to refer the patient and get the patient back and continue to care for them. And I think that way you have a better care for the entire population.
The government of Kenya has accepted the role of family medicine in the healthcare system.
We require doctors to manage the common problems in the rural areas. Somebody who have done family medicine will be able to handle medical problem, will be able to handle pediatric problem, will be able to handle obstetric emergency, will be able to handle surgical emergencies.
The main focus in family medicine training and what we tend to look for when we interview candidates for family medicine is an individual who is driven by need to care, health equity, and is compassionate about giving care to mostly the people who are not paying for it. It's very easy to give care for people who look for the best that money can buy. The focus in family medicine is a skilled clinician who is driven by the needs of the patient and who we would want to work within a community.
I'm Dino Suleiman. I'm 27 years old from Mombasa, Kenya. I'm here to find out more about family medicine. It's a specialty I'm really considering to specialize in. I'm a junior MO and I have 2 years of work experience. I'm going to meet Dr. Kanake. He's a first-year family medicine registrar. I think he's the best person to tell me about his motivations and why he chose family medicine. Since we are much on the same level, profession-wise, I think he's the best person to talk to. I'm looking for Dr. Kanake.
Yeah. I'm Dr. Kanake.
Oh, hi, I'm Dino. How did you come upon family medicine?
So I met a family physician. The way he was working, I think was very attractive to me. Immense abilities on almost every field.
Mm-hmm.
So you'd call him whenever you had difficulties in medicine, whenever you have difficulties in theater, doing SCS or something. He was also quite competitive in surgery.
So he was an all-rounder.
So he was an all-rounder, and I really wanted to become that. That's what was my passion, to really be able to do all that for the patient.
Why is it that specialized generalists will play an important role in the health system of Kenya?
Family medicine is very important because we are in a third world country, and third world countries are primarily because from people who are very poor and therefore need basic care. Now, family medicine is about providing good quality primary health care, and that is the foundation of any healthcare system.
If we are going to have universal health care in this country, primary care must be the foundation for health service delivery for our country. So for me, the values that healthcare should stand for is to have the right outcomes, which are the 9 areas. That care is accessible, is of good quality, it is safe, it's cost effective, it's efficient, it covers everyone, it is ethical and has a rights-based approach, it is sustainable. Those should be the drivers for every investments in the health sector. And family medicine is driven by the 9 principles, and it gives absolute satisfaction to any health provider, who is determined to make a difference for the people we are supposed to be working for.
This girl called Mildred came yesterday with conversions that were unremitting, something we call status epilepticus. We started with diazepam. It will not stop. We went ahead and gave phenobarbital. It will not stop. We had wanted to give phenytoin, which was not available. We sent the mother to buy the phenytoin, and she was not able to get the parenteral one. We, however, got oral, and we had decided to use that by giving it through an NG tube, and somehow managed to control the conversions. The other option would have been to refer the child, and that would have been difficult because the parents were not able to raise the money enough for that purpose. Now the child is doing well. We've just done an LP through a lot of improvising, and with the little resource we have, we've managed to get the CSF, or the cerebrospinal fluid, and it looks clear. At least we are happy we may not be dealing with the pyogenic meningitis. If the family doctor was not available, probably the patient would be referred to the next bigger hospital, and the transit time and the transport would have consumed valuable time and probably worsened the outcome for this child. And now the girl is able to talk and take something by mouth with no problem, and we are very pleased.
A lot of people are thinking that a medical officer is the same as a family doctor. Both are generalists. So why do we need family doctors if we can have cheap MOs?
Kenya needs family doctors because traditionally what has happened in medical training is our students are taught in blocks of the main specialties. Unfortunately, the majority of these graduates cannot be absorbed into further training, and they end up continuing to practice as registered medical officers with the basic knowledge that they had at the medical school. And this puts them at a huge disadvantage to be generalists with not so much training that focuses on generalism. They went through small blocks of specialist training as medical students and even as medical officer interns. So family medicine comes in to bring this together and focus more on those areas of health promotion and disease prevention. And in Kenya, if we focus that way, I think we are going to make a significant improvement in healthcare and especially the quality of generalist practice.
By the time you're getting a patient with a stroke, for example, it's a bit too late to do anything for these patients. They're already paralyzed on one half of their body, and they're going to be dependent on somebody or support from their family for the rest of their lives. Now, that patient started off with elevated blood pressure. It's very easy to check somebody's blood pressure. Now, we don't have enough trained clinicians in primary care. So if you don't have people who are adequately trained to detect these diseases as they begin to manifest, then by the time you're getting a patient with a stroke, can you imagine the cost on the healthcare system, the cost on the family, the cost to the individual, this doesn't make sense. It's cheaper to manage blood pressure when it begins by diet and exercise and very simple things and changing one's lifestyle than it is to try and rehabilitate a stroke patient. So when you look at it that way, then you can understand why we need family physicians.
I'm meeting Dr. Kiruka, who is one of the first family doctors in this country. He works for 6 years as a family physician in Iten.
Hi, how are you,
Doctor?
Okay. Yes.
So in essence, after graduating, you are considered a consultant?
Yes. Okay. You are a specialist, as per the definition of a specialist, recognized by the board.
Okay.
Yes.
So you are paid as a consultant. You earn more than an MO?
Definitely.
Okay.
Definitely. You earn more when you are hired. For example, when I was an MO, you know about the Kenyan system. I was employed in Job Group N.
Okay.
You know, I was a senior MO at Job Group N. When I finished, I was employed at Job Group P.
Okay.
And later on was promoted to Job Group Q.
Okay.
And as you know, in Kenya, you cannot move to Job Group P if you are not
of the
recognized specialist seen by a family physician.
As a family physician,
you can be able to address them. So in private practice,
clinic?
oh yeah, it's very possible.
Why not?
In fact, some people who have you are better placed to run a private practice when you are a family physician because no, I am a lecturer now.
I work at the Webuye County Hospital as a family physician, and at the same time I do part-time private practice at Sunrise Medical Center within Webuye town. I'll listen to your chest. Yeah, so let's first start with the neck. I see the general patients as a family physician. We see pediatrics, the children, the adults. We also sort out some surgical conditions which are outpatient in nature, and a number of maternal conditions as well as community health issues. Yeah, so I see all those as they may arise, at least most of them, but the few that I may not be able to see, I refer to the other specialists. So work together with my colleagues at the county hospital. My practice is part-time, and there are some rules which are set by the Medical Board of Kenya. We do this mainly during the off hours. So during the weekends and during the weekdays at the times that we are off duty. So those are the rules by the Medical Board, and that's what we do.
You've been practicing as a family physician for 6 years.
Yes.
Have you had any opposition from any of the other specialities out there, or is your specialty a welcome thing in the medical field?
No, actually, it is not welcomed in many quarters. A lot of people do not understand how you can be a specialist, yet you are a generalist. Generalist in the sense that you see everybody. People tend to draw patients to themselves and say, this is my patient, and more so because they are looking at how much will the patient pay, how much will I get from doing this operation in this patient. And so if you find there's somebody who wants to come in and he's claiming he can do all that, obviously that broods resistance, because we go to theater, we do cesarean sections that are supposed to be done by obstetricians. We see children, and that is the field of obstetricians. We see adult patients who have problems, and that is the field of internal medicine. And we also do some other general surgeries. So you can see that if it's about this patient belongs to a certain specialty, then we cut across, and that in a competitive world is probably not a welcome idea.
Okay.
Yes.
You do admit that family medicine has its limitations.
Yes, yeah, although you don't choose your patients, but in terms of seeing an undifferentiated patient, I would prefer that you see a family physician first, because then they are able to at least sort out a majority of the condition, up to 90% of the conditions that patients present with. Like we see gynecological patients, but now if you tell me that now I need to go and do repair VVFs, I don't do that, but I can diagnose and now refer the patient appropriately to the other specialists.
Jaribu kuinua hii. The role of the family physician in the casualty or the emergency department is to see the patient on the first contact. So the diagnosis is made at the casualty before they get into the wards. So the family physician sees the patient at admission, makes the diagnosis, and now filters them into the wards or into surgery. Hii picha umepigwa leo? Okay. With family physicians running the casualty department, the number of unnecessary admissions basically are reduced. So basically the wards are also, people can be managed in outpatient. The number of misdiagnoses is reduced so that people are not treated for a wrong diagnosis with less complications now. The result is that the people are correctly diagnosed early, complications are limited, and basically it helps in the health service delivery.